Hi, it's Dr. Noel Williams, Optimal Health Associates, Oklahoma City, Oklahoma. COVID update, April 26, 2021. Not doing them as frequently because COVID's coming down, so I don't want to inundate people with repetitive, unchanging information. So the latest data, we're down to about 25 active patients in the entire Integra system in the state. I think we're somewhere above 100 total hospitalized active patients in the state, maybe a little more than 100. So good news there. Our case numbers are running about 250 a day, which is very teeny tiny because remember, every human on the planet gets tested for COVID every day now. I mean, if you're traveling, if you're doing anything, there's more tests being done than you can shake a stick at. So if it's just an unreal number of testing with very few cases. So as I've been saying, we'd be done by May 1st. We're going to be done by May 1st. Does that mean no cases? No, it doesn't mean no cases, but it means that the pandemic is over. It is just a sporadic infection in our environment, and we don't really need to be so obsessed about it. And to highlight a few data points, sunlight kills the virus. I'll post the graph. Kills it in 7 minutes. And so guess where else it kills it? It kills it in your saliva with your mouth open. So what's the worst thing we could be doing on the outside? Wearing a mask. Okay, don't wear a mask outside. Let the sun hit your face. That way if there's COVID somewhere in your oral frontal area, the sunlight can help kill it. So everything we've done, so many of the things we said were wrong, but we didn't know. So my thing is, yes, we wanted things done a certain way to mitigate, but we didn't know what else to do. So once you get data sets that change, you change what you're doing. You don't stay with it. You don't go down with the sinking ship. I mean, oh, the torpedo's heading our way. Oh, we're gonna miss it. Oh, it hit us. But I'm gonna still say it didn't hit the ship. So we're not gonna acknowledge science. I have my new phrase. Well, it's not that new, but I always go, America, where science goes to die. It's just kind of the thing. I'm like, we've gone into an anti-science climate. It's all fear. It's the woke society of untruthfulness. It's getting rid of the past. It's all of this stuff. It's being embarrassed about our heritage. I mean, get over it. Come on. I mean, why lie about everything all the time? So let's say science matters. So the first thing, sunlight kills the virus in 7 minutes. Number 2, great study out of, MIT, a well-known institution for research, one of the top 10 schools in the country, academically revered, showing that, unfortunately, everyone can make fun of me for this, masks inside had very little effect. Okay, it was duration of being inside that mattered. So if you got over an hour in a space, it wasn't how close you were. Well, it didn't matter if you were a foot away or 60 feet away in the study. It was the amount of minutes you spent in the room that mattered for infection. And it had nothing to do with masks. Masks probably helped a little, but they were never going to be the number one solution. And we know that now, so let's get rid of them. Okay, straight from MIT, just like the surface stuff didn't work, or it wasn't so much it didn't work, it didn't matter. We're learning, so let's adjust. Why continue this legendary fear that doesn't need to exist? So MIT paper, I'll put that out too, but again, I'm just telling you the science, which doesn't seem to go over well with people, and that's life. I did have the opportunity to speak to the superintendent, the vice superintendent, and a couple other leadership people at Edmond Public Schools last week on last Tuesday about opportunities to adjust their plan. They were very receptive, very nice folks. Very intimidated to an extent, though, by what they've gone through. They've been treated at times, I think, very, very aggressively by people who occasionally may have needed to be kinder. But likewise, I understand parents get frustrated, but you have to remember the difference between myself and people like the Edmond School superintendent and those people is they're working, God willing, for us, and they didn't want to be in the limelight and be the center of this flu pandemic of COVID, whatever, you know what I mean? So the point is, they're doing the best they can. Now, from talking to them, I think they are a little inhibited by, half the school wanting them, and this is, I think, is germane for the entire country, not Edmond, Oklahoma, but they have half the people mad at them for making them wear masks when they really don't need to and not changing their policy. And they have the other half happy about it who will be irate if they don't make them wear masks. So it's like no matter what they do, they're kind of screwed. And so I feel for them, but I think they have to continue their hard work. Their, I think, initial policy was fantastic. I reviewed it with them briefly after reviewing it in general. And I'm trying to get them to move forward on some more progressive thought processes like, hey, they need to have their school fully open in the fall. They weren't willing to commit to that, but they're willing to think about it, which, you know, I think they need to do right away. But they are looking at some demasking opportunities for the younger kids, which I think is awesome. And I think the bottom line is they're trying. They're trying to do their best, and they have too many different opinions of too many different people giving them all kinds of information. They asked me why they should listen to me, and I was like, well, because I'm science-based. I didn't get mad when one of them was giving me a very hard time about a lot of different things, and I just went through the science and made her think about the science. And that's what I want to do with everyone. And I think these people are motivated. They have no intent, and I think this is germane for the whole country. No one who's managing children wants to not do it right. And they're just trying to do what they can. So just keep that in mind and try to be kind to these administrators who really have one of the worst jobs ever right now. So be nice to school administrators. Now, on the other hand, you can be nice to the teachers' unions unless they're telling everyone their teachers not to go to school once they get vaccinated. If you've been vaccinated and you're a teacher, you can work, okay? If you don't want to get vaccinated because of various reasons, then quit, okay? Or wear a mask, but go back to work. Kids need to go back to school. There's no reason for them not to. They don't need to wear masks. They already have had their childhood vaccines, which are protective, and there's no significant incidence of disease. And the disease process of COVID is less harmful than staying home. And I told one of the senior school administrators there that in 2 years, when we meet again, because I told her I won't forget this, and those of you who know me personally understand this, I will be asking her to review the suicide data with me in 2 years. And I promise you, unfortunately, it's going to be 50 to 1 at least, maybe more, of suicide increase for every child who died of COVID. And that's going to be directly correlated to the school closures. Now, that may be hard data to find in the next year, but 2 years from now, it's going to be obvious, and it's tragic. And not that these schools had any other choices, but we need to be on it, and we got to get it fixed. And it makes me angry when people act like it's not true, when we see the massive amount of alcoholism that's increased, the liver damage, poverty, all this stuff. So we have to be on board with understanding there's ramifications for keeping the school closed. And that's really the last final issue with COVID is normalization. We have to have the schools open. Be part of the solution. And now I'd say if your school is not opening and isn't getting on board with it, put pressure on them, run for the school board, make a change, make people be accountable to you to keep those kids in school. Kim's looking at me, so.
No, I thought you were done. The only thing I think on this one, because you started over, you didn't talk about India on this one.
Oh, yeah, India. So where is their cases? Well, India. They had 300,000 cases. We're down to the 40,000s. We're done. I mean, it's going to be pockets in the United States for a while. But remember, when you're testing everyone for everything all the time, we're going to find a lot more COVID. But it's on the dissipation. And so I think every one of these infections gives immunity. Unfortunately, I would like people to get immunity through the vaccine. But again, that's an issue for each person to decide. But don't whine if you don't get the vaccine and you then somehow they make you wear a mask. I don't necessarily agree with it. At this point, I think at this point, let people decide what they want to do, and let's move on, okay? But if you're vaccinated, you're done. If you've had the infection, you're done. So don't worry about it. And I've been saying that for forever, but that's what the data shows. Likewise, I had another thought about what's the big problem in India? What's the big problem in the UK? Why is Canada staying closed? Because they don't have vaccines. They don't have enough vaccines. So one of the things our government needs to do, since we're not going to use the AstraZeneca vaccine, thank goodness, we got 100 million of those doses. let's get the Biden administration to give those out. They've given out a few. They're holding on to them for some reason. I have no idea why. Since we don't need them. B, I don't think they're ever going to get approved by the FDA. So why not give them to Canada and Mexico so at least they can get their people vaccinated with something that's an okay vaccine but not a great vaccine? Because people are willing to use it in some countries, so let's give it to them and not hold on to it when the world needs it. I'm saying
So
I'm
is
a
it
lot.
just not as effective? Or-
No, the issue with the AstraZeneca, it's probably 65 to 70 vaccine efficacy, but overall its efficacy is probably going to be 90 to 95, maybe even 99 in terms of really limited disease. But there's a blood clotting issue that's a little more significant with it. And the data is not as, the problem for me with the AstraZeneca from the very beginning has been one central issue. They combined data sets. Moderna didn't do that, Pfizer didn't do that, Johnson & Johnson didn't do that. You can't take different studies and put them all together and do a meta-analysis on an emergency use drug for the entire world. You needed to do the study correctly. They went back on their word. Once you go back on your word that you've made public in a force, something this big, you're screwed, you're immoral, you're wrong, you don't deserve anyone's trust. And so they're done. They lied. And then they've had problems, and then they hedge on that. And it's kind of what I don't even want to talk about it. But so the bottom line is, no, you would never take the AstraZeneca vaccine because they're liars. And so if they've lied about it several times that we know of, how do you know they're not going to lie about it more?
But you would be comfortable sending it.
Yeah, I mean, I think it's still an okay vaccine. It's just, we're not going to get, if it's not going to get approved here, let's send it somewhere else where it can be approved. And yes, I mean, you got to keep in mind, everything with vaccines is risk. There's risk versus benefit. There are risks to getting the vaccine. I've said this many, many, many times. For me, the risk of getting the vaccine was smaller than the risk of getting a bad case of COVID, period. That's why I don't think peds should get it. I don't think really many people should get it under 21 unless they're higher risk. That's me though, that's how I look at the data. I look at how we did the HPV vaccine trial in my office, which I was, again, one of the principal investigators for, blah, blah, blah. We did the vaccine on young people after a bunch of preliminary stuff. We then followed them for 4 or 5 years. And then only after we'd followed them for that length of time, when we knew the outcome was good in terms of the results, in terms of preventing cervical dysplasia and cervical dysplasia, not cervical cancer, but you can't get cervical cancer if you don't get cervical dysplasia, blah, blah, blah. But also, nothing untoward happened. There wasn't this pulse of autoimmune disease or this pulse of anything. So that's why you could then release it. These vaccines are not, we don't know that same stuff yet. So why would you give it to a kid when there's essentially no harm? So I'm thinking what else I could have rambled on about today other than, hey, it's tornado season in Oklahoma, so we're all excited about that. And then I think getting back to normal life, I think our mask mandate ends
Friday?
I think Friday or Saturday. So yay, no more mask mandates. Now I'm still gonna tell, in Oklahoma City at least, so I would always encourage everyone to be courteous. I'll still wear a mask at a store. If they have a sign on, hopefully everyone's gonna go, hey, the mask mandate's over. We have essentially herd immunity here. We don't need it. So
I did read on that today. What they're saying is the mandate will probably lapse more than likely.
yay.
And they're
Stupid.
encouraging business owners to make their own decisions.
Right.
So,
And so the whole thing is the Johns Hopkins data is perfect. It came out this last week. Our mask mandate ends this week. Masks don't work inside that well. They're not effective. So why do them? We didn't know, now we do. We've had all this mixed data, but we now have some real data. And just remember the Stanford data, that guy also showed that they basically proved that essentially they were harmful for anyone at higher risk. So again, just science, 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 think. Science showing masks don't work, the mask mandate's coming off, why wear them? If there's a question, they're potentially harmful to older people and they're potentially harmful for sociologic reasons. 2, we're at herd immunity. We should be normalizing. We need people to get back to work, which is never going to happen since we're trying to hire people. And there's so much Oh, I'm being political. So much free money from the government, which everyone has to understand. You're going to have to pay for that free money. So don't worry, you're going to pay for it later, but that free money needs to stop so people will want to work. We can't get anyone to apply for jobs in our whole medical group. It's tragic. And from talking to people, it's everywhere. Restaurants, everywhere. All this free money needs to stop to people who can work. But again, that's going to offend a bunch of people. Sorry. But I have a bunch of employees and jobs and stuff. So we need workers, but no one wants to work. So that makes it hard. So anyway, good night. Take care. Thanks to all the doctors everywhere and nurses and school administrators. And again, big shout out to the police people. You've been awesome to the country. You've been through hell. And big shout out to the police departments everywhere. And that's it. Good night.